Hi, everybody. Thank you for watching On Call for All Kids. Today, we're going to be talking about how sleep and anxiety are related. We'll be discussing symptoms of a child or teen with sleep problems, how anxiety and sleep are related, and ways to treat and improve your child's sleep. I'm joined by Dr. Bobby Hopkins. She's the medical director of the Sleep Center here at Johns Hopkins All Children's Hospital. And it's great to have you here, Dr. Hopkins. How are you doing?
Great. Thank you so much.
So during this time, a lot of our sleep schedules have changed. And obviously, this is not only impacting us, but our kids and teens. How have they changed, and how might this be impacting their behavior?
Well, so with the change in sleep schedules, there's a whole group of kids that are actually doing better because they are able to go to bed and sleep as long as they want without having to get up and go to school and without having to engage in a lot of those extracurricular activities. But then there's another whole group of kids that no longer have a schedule. And so those kids are having a harder time. They're going to bed much later. They're waking up whenever they want. Sometimes they take a nap. And so their entire schedule is thrown off. When you have children whose schedules aren't predictable, then sometimes that can affect their behavior. Sometimes they're more sluggish or tired. Sometimes they're more angry or even depressed or anxious. Sometimes they have difficulties focusing. So for those kids that are trying to do homeschool right now, it might be more difficult if they don't have a typical schedule to follow.
Are there more symptoms that we should be looking for if we're seeing maybe a sleep related problem?
So sleep related problems are variable. You can have sleep problems where the child is having difficulties going to sleep. Maybe they have trouble staying asleep. Sometimes, particularly in this time, they might have difficulties with nightmares or sleep terrors, and then obviously difficulties waking up or feeling sleepy during the day. If a child doesn't sleep enough, they might have difficulties focusing or being more emotional or moody throughout the day. And then anxiety and depression are more common.
Yeah, how is it that anxiety and sleep are related? What's the relation between those two?
So I often tell people that the anxiety can result in sleep problems, and then sleep problems can then contribute to anxiety, creating more of a cycle. So if a child were to be anxious, they might not be able to fall asleep, and then if they don't sleep well, they're anxious the next day. If you were to create a very specific routine, that's one of the best ways to help a child reduce their anxiety.
Should our children maybe be taking medications for this sleep related anxiety, or what's your advice on that?
So there's some kids who definitely benefit from medications to go to sleep. However, these are few and far between. Um, Most medications should be paired with a very strict bedtime and a very strict wake time schedule. I also often recommend that kids learn how to do meditation or controlling their own anxiety. And then obviously, excellent sleep hygiene where they're not drinking caffeine during the day and they're not watching TV before bed. Ideally, that if a child were to need medication to go to sleep, then this would be prescribed by a physician who's familiar with both the medications as well as what we call cognitive behavioral therapy for insomnia. And that would need to be implemented hopefully prior to using medications for sleep.
Are there any other basic tips that we as families can implement in order to help reduce some of these sleep related anxiety problems?
Yeah, so number one, we often talk about making sure that there's a very set routine, a set bedtime, and a set wake time, making sure that the child has an age appropriate amount of sleep on a nightly basis. And a good rule of thumb is that the average 10-year-old needs about 10 hours of sleep. Older kids probably need just a little bit less. Even teens need 9 and a half hours of sleep. And then younger kids need more sleep. So, like a 6-year-old might need up to 12 hours of sleep. Um, Number two, we talked about monitoring electronics, so TV programs, video games, and social media. Right now, there's a lot of things that can play into how anxious a child might feel. It might be the news, it might be um, social media talking about a lot of difficult topics for kids, but then also kids are having a lot more exposure to their regular video games. So depending on the content of the TV and the video games that they're exposed to, this might affect their anxiety. In general, we recommend that kids eliminate electronics at least an hour before bed. Number 3, we talk about eliminating caffeine. We don't want the kids to drink a lot of caffeine prior to sleep. And some people don't realize that caffeine is found in tea as well as coffee and soda. For children specifically that are anxious, they often have difficulties turning off their thoughts. And so ways to combat that would be to allow the child to talk about their fears earlier on in the day, or even write those down so that they don't ruminate on those as they go to sleep. When it's time to go to bed, sometimes kids with anxiety have difficulties shutting down their thoughts in a way that helps them to go to sleep. So often I'll ask them to do some deep breathing or progressive muscle relaxation. For those families that aren't familiar with those types of exercises, or for very young children, there's a variety of different apps that one can download and help the kids learn how to do that and help them to relax their brains before they go to sleep.
All right, Dr. Hopkins, thank you so much for joining us today. And thank you all for watching as well. If you have a topic you would like us to look into, you can comment below right here on this video. And you can also check out our website. It's hopkinsallchildrens.org/coronavirus. And you will find a lot of wonderful resources there as well. Thanks for watching. We'll see you next week.